At OSJCT, we believe that good care starts with knowing the person and shaping the right support to the individual. Our approach to dementia care is exactly the same, but sometimes it requires a little more help to really get to know the person. The next few minutes of film will give you an understanding of how we approach caring for someone with dementia, meeting the needs of memory loss, changing behaviours, and recognising what support they'll benefit from. Above all, our aim is to work closely with those who live with us, their families and loved ones, helping to maintain relationships and provide the reassurance of supportive day-to-day care. We hope this film will help answer some of the questions you will have.
Our approach to looking after people with dementia and our philosophy is very much based on our belief in person-centred care. So we take that approach through everything that we do, and in order to have a good solid foundation, we start with understanding the individual person, and we do that by collecting information that we call life stories. So it's very important to us that we understand from the individual, and quite often from their families and friends, what made them the person that they are.
Good dementia care is important because dementia is on the rise. People are coming into care homes with dementia more often. I think we need to have a better understanding of it, and I think OSJ do have a better understanding.
If you've seen one person with dementia, you've seen one person with dementia, and that's the underpinning philosophy of OSJ. Every single person is unique, every single person has their own history, their own culture, and you cannot box people together into a diagnosis like dementia.
What we tend to do with OSJCT is work with them to try and build on the skills that they already have and to share those skills. We have a number of residents here at Bemerton Lodge that have taught staff how to cook.
We as an organisation, through the things that we're doing, the introduction of themed destinations and things, are learning all the time. It's our aim to be one of the best providers of dementia care out there, and we believe that we're well placed to grow into that role. If you consider that a resident who lives in a home comes into contact with all different members of the team, then it is very important to us that all of our staff understand the basics around what is dementia, how it affects people, and how therefore you can best support them.
We have a formal training programme that helps us to ensure that all staff are trained. We run courses from one-day workshops to certificated courses. Currently we're working very closely with the Alzheimer's Society. I'm a gold standard trainer with the Alzheimer's Society, as are 4 other trainers within the organisation. That means that we can be assured that we are quality assured by the Alzheimer's Society to be able to offer and run their certificated courses.
We have just recently put in a new facility which is a themed destination. It is reminiscent of an old shopping arcade. It's got a sweet shop, a cinema, hairdressers, an indoor potting shed, a tea room and a conservatory area.
All of these things are to support the resident to have somewhere to go to, something to enjoy. It gives sounds, it gives noise, it gives smells, it gives visual opportunity to connect with an individual whose level of confusion might make that harder for them.
So the family can use this area to take their individual that they've come to visit, and it will trigger memories, it will stimulate conversation, and it will help support their visit.
With our residents with dementia in particular, we try and involve them in the normal things that go on during a day in a normal household.
As human beings, we need to feel in life that we're achieving whatever it is, and so it's really important that people with dementia are given the opportunity to achieve from the smallest thing, laying tables, making beds, to bigger activities such as digging allotments, trips out.
The benefits for the residents in that is that A, they're occupied, so therefore they're being mentally and physically stimulated, so they're using energy, they're mobile, they're using dexterous tasks, they are connecting their thought processes with what they're doing in practice. They are able to feel that they've done something that gathers praise or is valued, or they're doing it in partnership with somebody else. So all the aspects of our own lifestyle that we take for granted can be filtered back in through enabling residents to be meaningfully occupied. As an organisation, we fully endorse the more national agenda in eradicating inappropriate prescribing. To do that, we need to work with our colleagues on the health side, the families and the residents themselves.
We lead in trying not to use unnecessary medication for our patients. We look for non-medical solutions, and most of that is a combination of understanding and training. If we can help this resident without an antipsychotic, it's better for the resident, but you can see the pride in the workers, the care staff, in helping a person's need without that.
Admiral nurses, in their own right, are specialists in the field of dementia.
My role as an Admiral nurse within the Trust is to provide the best care for the residents with dementia care. This would be looking at therapeutic approaches, working with personalisation within the units, looking at life story work, which is absolutely essential in getting to know the residents.
We are the second organisation to have actually employed one direct to work within their care homes.
Admiral nurses are good for the Trust because we bring along a lot of expertise with us, and this comes in the form of support from Dementia UK because they provide a lot of training.
At OSJCT, we wouldn't want to underestimate the importance of making the right decisions when considering support with dementia care. We hope that this short introduction to what we believe is important and how we aim to approach the care of anyone who uses our services has been of assistance to you. To obtain more information, don't hesitate to contact us.